The College Student Right to Access Act would require all on-campus student health centers at public universities to provide medication for early pregnancy termination for their students by July 1 of 2023. Research from UC San Francisco estimates that every month, 519 students at the 34 UC and CSU campuses seek medication abortions at off-site healthcare facilities. If we truly value access to abortion in California and the importance of supporting student success, then it's critical that these hundreds of students every month are able to access these services on campus. Medication abortion is a two-step process where a patient takes 2 sets of pills over the course of 2 days during the first 10 weeks of pregnancy.
Angela Gilliard with the University of California. We are not in support or in opposition. We have a no position on the bill. May we approach to read a brief statement?
Typically, we take opposition or support. Will you just very briefly state your position? Just state your concerns briefly from there, please.
Okay. So the University of California mandates that all students have health care. The university operates a health plan for students called UC SHIP. Reproductive health care is considered an essential benefit for students, and the university fully supports reproductive rights for its students. We have not wavered in our resolve. However, UC does not have a position on SB 24 because there are outstanding issues we are working through with the author. The issues are primarily around implementation and costs. While most of the public conversation surrounding the bill is centered on women's rights to choose, this has never been an issue for the university. We have made it clear on repeated occasions that we support a woman's right to choose. The problems with access to this service are not proximity, rather the problems are that referrals have not been made seamlessly, and they should be. For these reasons, we understand the authors would like the service to be provided on campuses directly, which will help resolve some of the insurance connection type issues students have experienced. We have been working on solutions with the author's office, and we still need to solve a few problems related to funding beyond implementation in 2023. Bringing this service on campus without a funding source beyond 2023 could increase costs to students since student health centers are supported by student fees. We know we have a champion and a good working relationship with Senator Leva's office and are hopeful that we can resolve these out funding issues. Thank you.
Okay, thank you.
Hi, Maggie White with the California State University. I'll be very brief. We are in a pending position on the bill, but want to thank the author and her staff for the ongoing dialogue. We continue to have concerns around implementation and ongoing costs. We look forward to addressing this collaboratively with the author and her staff. Thank you.
Thank you very much.
Hi, my name is Mary Lee Schreider. I'm Executive Director of Right to Life of Kern County and Political Advocacy Chair for Californians for Life. I'm here merely to answer any questions you may have, but I would like to yield my 3 minutes to Dr. Bratz for 6 minutes.
Actually, it's 3 minutes each, so thank you.
Good afternoon, Mr. Chairman and committee members. I'm Dr. Stephen Bratz. I'm a board-certified OBGYN with 35 years of practice experience. I first came to California in 1992 as a Navy doctor, stationed at the Marine Corps base at Camp Pendleton, and I also served many years at the Naval Medical Center in San Diego as the chairman of the OBGYN department there. I've served with the Marine Corps 1st Medical Battalion in Somalia in the Iraq War. I retired from the Navy in 2008, moved to Susanville, wanted to work in an area where there was a lot of medical need, and really enjoyed practicing there for the last 11 years. My wife and I have 3 kids who've all graduated from California universities. I'm currently serving on the board of the American Association of Pro-Life Obstetricians and Gynecologists. With medical abortion on college campuses, what will be the risk for patients? With medical abortion, we find that complications are not so rare. Women who take mifepristone for abortion have much greater risk of hemorrhage and fatal infection and more failures requiring emergency surgery than women who have surgical abortion. The complication rate, including cases of hemorrhage, infection, or where surgery was performed, is in most studies 3 to 6%, and I've filed my references with the Master at Arms. They are on file. In one study, the rate of hemorrhage was 15%, and in another, 17% of patients required surgery. Complication rates could be even higher than we find in the literature because of difficulties with billing codes and large numbers of patients lost to follow-up in some studies. So roughly 1 out of every 20 women who have a medical abortion will have a complication such as bleeding, sometimes requiring a blood transfusion, and or need for surgery because of pregnancy tissue left inside the uterus. Between 2000 and the end of 2018, there were 4,195 adverse events reported to the FDA, including 24 deaths, 97 ectopic pregnancies, over 1,000 hospitalizations, excluding deaths, and 499 blood transfusions and 412 infections. I've had an opportunity to look at these adverse event reports. Do I have the whole 6 minutes?
They said only 3.
You have 3 minutes.
Okay. So the bottom line here is that some complications are going to occur. And the question is, are we ready to handle those complications? Continuity of care is something we strive for and safeguard patients and maintain quality. With especially medical abortion, patients having complications sometimes find that the clinic is closed and show up in the emergency room. If the 24-hour hotline is telling patients to go to the emergency room, it's not good continuity of care. Ultrasound procedures need supervision. Training doctors, nurses to do that will be difficult and will require a large volume of patients for supervised ultrasound training. This bill won't meet its stated objectives. Misoprostone abortions will be inconvenient for patients, taking much longer to complete compared with surgical abortion. Medical abortion requires a visit to receive the drugs, hours or days of cramping and bleeding, a possible ER visit, and then follow up with the clinic again. According to data compiled by Californians for Life, abortion clinics are located an average of only 6 miles from universities in California. As a physician, I'm concerned for the quality of care or lack of care patients with complications will receive, and for the university system's ability to manage these complications. As a California taxpayer, veteran, and pro-life Californian, I oppose and ask you to defeat SB 24. Thank you so much for your attention.
We were under the impression that if I yielded, he could have all 6. Can I have a minute?
You can have 1 minute.
I can have 1 minute. Very good. In committee hearings on the bill, witness testimony and legislators' inquiries focused on medication abortions, perceived impediments to pregnant students' access to such abortions, and related cost and liability concerns. However, at no time has anyone posed the most relevant question: is abortion medication by techniques the most effective method in reaching the stated goals of SB 24? Research by recognized experts in obstetrics and gynecology strongly indicates it is not. In his veto message of SB 320, Governor Jerry Brown dismissed the bill as unnecessary, but he was only half correct. Not only are abortions by medication techniques unnecessary on college campus, they are contraindicated. According to the American College of Obstetricians and Gynecologists, a pro-choice professional organization of more than 58,000 members, women who desire quick completion of the abortion process are not considered good candidates for medical abortions. I'd also like to add that the fact that anything speech, guns, abortions is a constitutional right does not preclude citizens from implementing some limited restrictions. Law-abiding permit-carrying gun owners cannot carry their guns everywhere they wish, including into this Capitol building, and as a matter of consistency, it is not the state's role to make sure concealed carry permit holders have access to all the firearms they desire. Then it is likewise not the state's role to mandate that college students are never inconvenienced in pursuit of unlimited access to abortions. Nor is it the state's role to mandate that public universities be obligated to provide access to abortions on their premises, and furthermore, to be open to using student fees to do so. Thank you.